Hello guys, so this is our fourth meeting in cross and multicultural understanding subject. So our topic today is about dominant American culture patterns. Okay, let's move on to the next slide. Okay, the dimension of American culture. Cultural aspects of everyday life are often difficult for people of dominant cultures to discern about their practice, traditions, values, and understanding are taken for granted as the norm. For them, there's no apparent need to examine cultural difference and thus no inclination to do so. In the US, middle class European Americans are typically so unaware of their own culture. They believe that American culture is the melting pot of other cultures. This misperception is further complicated by confusion over terms such as Caucasian, the dominant majority, mainstream, middle class, Western, and so on. For our purpose here specifically, where we use the terms American and American cultures, we refer to cultural ways of the group that in recent decades has held a mainstream position in North America. These are people who are primarily of Western European descent with a social position that is often characterized as middle class on the basis of having participated in high levels of formal schooling and associated occupation. This is based on Rogov in 2003. Now that we have established what the term American points to in this article, let's begin to look at some specific dimension of American culture. A dimension of culture is a recognizable point of comparison used to explain how different cultures prefer to approach and solve a universal problem. There are more cultural dimensions that we can possibly address here, so we will focus on a few that seem especially relevant to patient or provider interactions. American culture. A dimension of culture is a recognizable point of comparison used to explain how different cultures prefer to approach and solve a universal problem. Uh, and then there are more cultural dimensions that we can possibly address here, so we will focus on a few that seem especially relevant to patients or provider interactions. Time and its control. For Americans, time is a critical factor that is battled on a daily basis, and then we are in an adversarial relationship to time, and we talk about saving or wasting time, managing time, and beating the clock. Americans invented day timers and added the term multitasking to the English language. We invented fast food and made it even faster by adding the drive-through. Now, even our pharmacies over drive-through pick up, right? So many of other cultures in the world have a more relaxed view of time. In healthcare setting, busy practitioners may not realize that patients from different cultures often experience the rush pace of an office visit as disturbingly impersonal. It is important to slow down enough to exchange a few words of personal conversation with patients. Ask how their family is doing. This gesture only takes a few moments. It puts patients more at ease so they can respond more openly to medical questions. If the doctor is in a big hurry, Patients won't ask for clarification about treatment and medications. Establishing the conversational style also helps providers introduce conversation about cultural belief around illness, which can be very important in the diagnosing and achieving patient compliance. As a physician will succeed best with patients more different from different culture when the care and the cure are experienced as inseparable. And this is task versus relationship. Very closely very closely related to time control is the American tendency to focus on getting things accomplished, so much so that building rapport with people gets overlooked. In more traditional culture, people focus on establishing rapport first and ensuring harmony in interaction with others. In healthcare setting, building trust between patient and doctor often depend on developing formal but warm interactions. In Spanish, the word personalismo speaks to this balance of professionalism and friendliness. Taking a moment to ask about the family, a second that lingers just a bit longer than a business handshake. Simple gesture as such as this go a long way. And comfort with change. Americans are fundamentally optimistic and place faith in the future. As a young culture with few traditions trying us to waste the past, our identity and inspiration are projected forward in time. Americans link change to progress, development, and growth. We like things that are new and improve, although traditional culture considers change to be disruptive and unpredictable. In other words, negative. When new medical procedure or miracle drug becomes available, Americans can likely to respond with optimism, while patients from risk adverse culture will show pessimism. So doctors who demonstrate balance in this area will gain the most patient confidence. And clearly risk avoidance varies from person to person with a culture, and a plenty of Americans reverse what's safe and predictable too. But as a generalization, we in the US do tend to take chance and embrace change. Personal control over destiny. American tends to believe that every individual has primary control over his or her destiny. There isn't typically a strong belief in this power of fate or karma. In many cultures, there is a belief a thing, including illnesses, happen for a reason and may be beyond our control. People may show a tendency to resign themselves to bad things in a way that America never would. It's a God, it's a God's will. This doesn't mean patients or families won't put faith in American doctor medicine, but they may be surprising belief system operating around what has caused illness and how much control they can exert on the outcome. A Hispanic mother may believe that her children as maldioso or has been cursed with the evil eyes. And member of the traditional Hmong culture believe a baby can be detained by a malevolent spirit called a debt, causing a number of serious illnesses, including epilepsy. Okay.